With advent of the JAK inhibitors, we cover the control of the spleen and symptoms, and we can cover that in patients with high counts and low counts. We have now, in addition to ruxolitinib and fedratinib, also pacritinib, and in near future, momelotinib may be out there as another JAK inhibitor, which is non-myelosuppressive and improves the anemia. But where do we go from JAK inhibitors? After JAK inhibitors, even when you sequence one after the other, there is still need for more. None of these medications work forever. There is always a limitation in duration of the benefit. And so we are looking for other therapies after JAK inhibitors. To simplify, this would be a second line after JAK inhibitors. And in that setting, biology of the disease is much more complicated. There are many other abnormalities that we can target with different drugs. And for example, we have a phase 3 study underway comparing the Navtemadlin, which is MDM2 inhibitor of P53 gene activity. That's probably the simplest way to describe it. This Navtemadlin is a pill that is being compared to best available therapy in a second-line setting to control the spleen and symptoms. You have also a phase 3 study with Imetelstat, the telomerase inhibitor, IV drug every 3 weeks, which is compared to best available therapy in a second-line setting to prolong life. A first ever study with the survival benefit as the endpoint. This is one aspect of area of unmet need. The other is more of a benefit on the anemia. If momelotinib will improve that to some degree, we need more specific and more powerful anemia drugs that we can combine with other JAK inhibitors, with the ruxolitinib or fedratinib, for example. In that setting, so anemia as area of unmet need, we have underway a phase 3 study, placebo-controlled, comparing luspatercept to placebo in people who are on ruxolitinib, deriving benefit on the spleen and symptoms, but requiring transfusions. The goal is here elimination of transfusions, transfusion independence. And of course, area of number 3 of our need is to boost what the JAK inhibitors do. I mean, they help many people, but there is always an improvement on the control of the spleen and symptoms that one can envision. Here we have a phase 3 studies underway with medications like a BET inhibitor, pelabresib, or a phase 3 study, the Navtemadlin, BCL-XL inhibitor, or parsaclisib, the PI3 kinase inhibitor. These are 3 drugs that are being added on to ruxolitinib in people who have a spleen and symptom problem, with the goal, comparing it to placebo, to boost that response. So another view of how we can improve management of our patients. So you see the areas of second line, area of anemia, second line in terms of after JAK inhibitors. But then the last one that I described is adding a medication to JAK inhibitors, combination strategies are evolving as well. So a lot of activities in myelofibrosis.